testing for COVID-19 is imperative in confirming symptoms and getting a timely diagnosis and treatment. So what exactly does the testing look like? Come with me.
For purposes of this simulation, I was a walk-in patient. Ideally, you're encouraged to call using the hotline. If the doctor believes you need to be tested, an ambulance would come pick you up and bring you to hospital. Once at the hospital, I was given a mask to put on before I explained my symptoms.
What we don't want to do is test asymptomatic people, people with no symptoms. Most people who don't have symptoms, even if they're incubating the virus, will test negative. So what that would do is give a false sense of assurance that somebody now is negative, and then they can still go on and transmit. So generally, the test should be done when symptoms develop.
I feel like I have the symptoms. I have a fever.
Have they been to a place or in contact with somebody within the last 14 days that they might have been exposed to COVID-19? Then the main two symptoms are fever and cough. The cough tends to be a deep cough from the chest, not an upper airway cough. And it's a bit hard to demonstrate the difference, but if you have one versus the other, you will know. They don't tend to have runny nose. That's very uncommon.
Once established that I met all the symptom requirements, I was then escorted into the isolation room. The room had negative air pressure, which means that the suction force in the room could not transmit any of my airborne particles.
Then the person collecting the test will put on appropriate protective equipment, and that will normally include a mask, goggles or an eye shield, the gown, and gloves.
The doctor then met me inquiring about my travel history and symptoms once more. And this is where it got interesting.
Then they will put the swab into the nasopharynx, which is way back in the nose. And the Ministry of Health is also collecting oropharyngeal swabs, so that's from the back of the throat. The most important one, though, is the nasopharyngeal, because that is where the highest number of virus particles will be.
Is that fine? Just gently, okay. My sample will now be taken to the lab, where it will take 1 or 2 days to get tested. Until then, I am advised to be in self-quarantine, which usually means isolating myself from most people and waiting until the lab results come out. Anita Nkonge, NTV.
So, I'll throw it to the panel. Is this an apt simulation of what someone would expect if they walked in? Just start with you, Moses, as we go to Dr. Mureithi.
I mean, this looks like the ideal situation, except for the part that she walked into a hospital instead of calling. I guess it was necessary for this part of the story. But there could be a lot of variations to this, that first you may call and then the officials will tell you to wait at home, will come to you.
Yes.
But I like the fact that the healthcare worker here took the measures necessary to protect herself and her colleagues, and the doctor who came to collect the sample also took the measures that are required, which is what would protect the healthcare worker and also prevent passing over this virus to others, which is good. Okay. And the fact that they also took the sample from the nose instead of the mouth, that is where you need to get this sample from. So I think in many ways this was ideal, but as I said, in real life situation there could be lots of variations. Right. That even before you notice, if somebody just walked in and they didn't say what they had, by the time you notice that they have this condition, they may have exposed other people in the waiting area. So that's why many hospitals have now put triad so that they can try and identify such persons. Okay. But the most important thing I would say is that if you're going to a facility and you suspect that you have symptoms or you've been exposed to COVID-19, call first and warn the healthcare worker, or when you get there, find a way to warn them before you can mingle with other patients and other healthcare workers. Okay. That is very important.
And just to differentiate the process, because earlier we were told by CS Mutahi Kagwe that there's screening, 600,000 cases of people who have entered the country, and then there's testing, 173 at least. The differentiation in that, because it seems we've confused the audience in the terminologies there.
Yes, so those are two different terminologies. So let's start from there, because I also saw even the CS was trying to really explain
Yes.
the differences. So the screening, the 600,000, first of all, that's impressive. And this is where they try and take your history. They will not take any of your samples. They'll not...
Even the heat, like your temperature?
They start with the heat, but even before that, your history. Have you traveled? Do you think you've come into contact with anybody who's infected? And then they would probably ask you about symptoms, as they take your temperature as well. So that's the screening process, where they just try and meet the case definition that has trickled down from WHO to Ministry of Health, as they tick those symptoms as what we saw in the screen. Yes, the dry cough and headaches, the fever. If you tick all those boxes, then you're taken now for the testing. And that's why you've seen the numbers from 600,000 to 173 testing. So those 173, either they had a travel history, they've probably come into contact with someone who displayed the symptoms, and maybe they're also exhibiting some of the symptoms, where they have to go through that testing that we have seen, where the samples are taken, and within a day or two, they get the results back.
And just to clarify, because there are some institutions, when the private ones at least, the people are told there is the expectation there will be a charge. But with the centers that have been designated for screening and testing, to be specific, people shouldn't expect to be charged for that.
It's free of charge, and that has been emphasized over and over again by the Ministry of Health. Unless now, I don't know about Aga Khan, but the testing that is being offered at the moment should be free of charge, and it is free of charge.
There is a concern then, Mwinzi, if we put on these stories and encourage people to go to test, it'll be like a run on the bank, and there'll be a run to the hospitals, and then the concern of, are there enough kits? And people are generally, and rightfully so, encouraged or discouraged to just go for testing, just to get a clean bill of health. How do we control this?
It's the tone of our reporting and what we are putting out there. So long as we are not telling people to rush to hospitals and get tested, we are telling them, if you have these symptoms, then probably you need to talk to your doctor about this. You need to go check. Probably the first point of call is not even at the testing facilities, it's to your doctor. And then the doctor tells you, yeah, I think for this one, we might need to refer you to this other place. The most important is that we tell people and we differentiate, just the usual symptoms that we have. And they have seen some boxes. We've been publishing some documents. If you have these and these and these, you probably just have a normal flu. But if you have these and these and these, maybe you might need to go and get tested.
There has been the concern of whether there are enough kits for testing. So do you think, on the reverse, it probably prepares someone to think, what's the use to go if they're not enough? And right now we have 2 designated centers for this particular issue. Thinking about someone uko mashinani, how do we communicate?
I think it's not for us to start talking about whether there are enough testing kits. As journalists, it's not for us to start.
It was put to the CS today.
Yes. The CS is the one who's supposed to tell us whether we have. But we as journalists cannot now start prosecuting that matter. Do we have enough testing kits or not? Unless we want to be judgmental about this. But the only thing that we can do is put that question to a person in authority. Do we have enough testing kits? If that person tells us yes, we do. Unless we want to do an investigative piece and go to these hospitals and all these centers and say, they are telling us they have enough. Kumbe, we only have 1,000 testing kits. Do not come here.
But will it serve any purpose to bring that out and to realistically say there's not enough kits to test everyone in this country?
What we are doing now as journalists is to assure the public that everything is in control. Already people are panicking. They are saying, if this thing comes here, and it is here, then we are doomed. We are dead. You don't now also want to create this other panic that we do not have enough testing kits if you do not have the information. If you have the right information and you have the facts, you have the evidence that, yes, we do not have enough testing kits, then, yes, you can tell that story. But our responsibility right now is to calm down the temperatures, calm down the people who are panicking all over. Tell them this is what you need to do if you suspect you have this, and then tell them, go. If they go there and they are not tested, then you will report that. We will say they went there, the government told them to go there, we send them there, but there were no testing kits.
Yes.
And then now becomes a big story.
But in realistic terms, what is enough testing kits? Because people think it is one for every Kenyan.
Yeah. I was actually thinking about that also. Do we have enough kits to test 50 million Kenyans? Definitely no. We don't have the capacity. Do we have the capacity to test the number that requires to be tested? I think we do. And they've already demonstrated that by having screened more than 500,000 people and tested those that require to be tested, that the capacity is there. We can expand that capacity, and I hope we do in the coming days. But the most important bit about not testing everybody is the time we will take to discover people who are actually infected. If today we say every Kenyan can go for a test, tomorrow we'll have millions of people going for the testing. And what that does is that it delays our ability to detect those who are actually sick. And because every day you delay, they infect or they risk infecting other people, that doesn't serve us at all. So why we need to screen first, which is quick, so that we can get to those people who actually need to be tested, that allows us to detect this infection much earlier, rather than just testing everybody for the sake of testing, because by the time we get to the one person that is infected, we've taken a long time. And yes, we cannot test every Kenyan, it's not necessary, but we should be able to test those that require that testing.
And let's listen to, before I give you a chance to respond to what CS Mutahi Kagwe said earlier today, that there will be random testing starting, screening starting this particular Saturday. And let's listen into that, and then Dr. Mureithi, you'll respond.
As members of the Fourth Estate, I urge you to continue to educate and affirm that this situation is real. It cannot be unreal in Kenya when it is real in China, it is real in the United States, in Spain, in Italy, and we think that in Kenya, it is something to joke around with. It is not. It is not. And sometimes one is baffled by some of the reaction that we are getting. Please, please, let's take this matter seriously. Secondly, we will embark on random screening in targeted areas for members of the public, commencing this Saturday, March 21st, 2020.
This is unprecedented. A lot of what we're facing is unprecedented, but I'd like to get from a medical perspective, perhaps what they're trying to get at, because for Mwananchi, they're thinking, hey, niko mahali na date, alafu kidogo kidogo. And you stand there, let's, get your temperature and all that. What are they getting at with this, and, just to inform the Mwananchi?
Okay, first of all, I really like how serious, from his point of view, this is, and that should be felt by everybody. This is a serious matter. It's not business as usual. And for him to say, state about random testing, really what they're trying to figure out or investigate, is there local transmission of this virus? Is there anyone, a member of the community, who's probably not a contact of any of these cases that have so far been reported? Is there any one of them who could be meeting this case definition, who could be carrying the virus, and who needs very early intervention before it cascades over and over again to the community? So here, they're really trying to catch local or community transmission that has no relation to the people that have either met, who have tested positive or not. So this is very crucial in terms of controlling the disease.
And it's perhaps in the mapping out, because they're saying they've followed 145 cases at least, and there's a point about mapping out that you'll bring out, Bwana Mwinzi. But if they do find that you are, you have it, they have a reason to believe that there's follow-up that needs to happen, then will they take you in, not take you in, it's not prison, but will they take you to a medical center? What will happen? What should a Kenyan expect?
And I'm hoping that if we get to that point where someone tests positive in this random testing, they'll have been caught early before they've already started interacting with many other more people, taken out of this community or this setting and put under quarantine, where either now they'll follow up with the symptoms, if they need any treatment, any supportive treatment, because also from what we are seeing, if this is caught early enough before it becomes severe, this person either experiences mild type of infection, which can either resolve by itself with probably very little intervention without needing an ICU. So this is very good. So the public should not be alarmed by it. It's very important. And if any of these cases are caught, again, we should not now go into panic mode. This is really crucial so that we can take this person who's tested positive, and hopefully there'll be none, quarantine them, and take care of that infection before we get to a place where we overwhelm our system, our healthcare system, and also we don't want also this transmission, the routes of transmission, to continue over and over again in the community. So this is good.
Yes, Mwenzi, when he started that particular statement that we've just played, he said he calls upon the media to draw the true picture and show Kenyans that it's real. And we've encountered people who still, look at it and feel, hey, is this thing really here? So have we failed in our jobs not having people feel or believe that it's here? And how do we balance that versus being alarmist?
I think that for me is the biggest test. How we can balance the need to inform people, to tell them that this thing is here and it's dangerous, and the need not to create panic among the communities. Once, and especially, I think that's where we are heading. If you notice, all the declared cases, all the confirmed cases have a history of travel. Yeah? So that means, as yet, we've not confirmed community transmission. But once we get to that phase, then we are entering a different place altogether, because it's a very dangerous. We are creating clusters of infected communities that will be very, very hard to monitor and very, very hard to control. So it's important. It's important that we tell people, we show them that this is where we are now. As far as we are concerned, the confirmed cases are only those who have a history of travel. But as people who are interested in getting to know what is happening, and as media organizations, it is our responsibility now to show people and to inform them that while we might not have one confirmed local transmission case, it might be there.
Yes.
Yeah?
Because of the interaction.
Yes. Of course, we are not going to say it's there, but we are creating that scenario that it might be there. And that's the reason we are taking all these precautions.
Yes.
Why, for instance, are we installing hand washers and sanitizers all over town? Yeah, it's because we are trying to control, to minimize any risk of community transmission.
Yes. Somewhat contain it.
And contain it.
Yes.
What I feel, however, is that we in the media are caught in a very bad place. Because you're seeing a lot of things happening that you say, I actually want to write about this. I should write about this. I should pontificate about this. But unfortunately, you can't. Because if you do, then you'll be creating panic. And there have been concerns, especially among journalists and the media community generally, that the media seems to be a bit muzzled in the way it is reporting this.
But there's that thing we say on a daily basis, come and buy. And this is not just out of getting, clicks or selling the paper, but it is in our interest to protect the nation. And this was reported about Wuhan itself. The doctor who actually, the whistleblower, he, was punished at first in terms of, bringing it out, and he passed on. Aren't we then doing an injustice if we feel there's something we need to report on?
No, we are not. I don't think we are, because we are not just reporting any other story. You're not reporting the story about a political rally somewhere.
True.
This is a matter of life and death. It's a science story. It's a health story. There are ethical guidelines on how you can report it. I've seen people, for instance, saying, how come we do not have evidence of the names of the people who have been confirmed infected? Basically, people are telling us, you need to publish the names of people who are infected. From a medical perspective, that is wrong. From a journalistic perspective, that is also wrong. You cannot declare, you cannot go out and tell people, oh, by the way, Mark has this thing. You cannot. All right? Yet people are demanding that evidence. And there are clusters of people who are saying, so long as we do not have that evidence, so that we do not have names, then this thing is not here. Those are people that will require, and that's the reason we are creating all these, scenarios and ensuring that we carry out the messaging, going out on TV, on radio, in our newspapers, on social media, and creating synergies with experts in the field and with the Ministry of Health, to tell people that this thing is actually here. We are drawing examples from Wuhan. We are showing people the photos and videos of what is happening in Italy. We are not doing that to create a sense of panic, but to show people that this thing is here. Italy was where we are now about 2 or 3 weeks ago. Just 2 cases. We are going to beat this. Yeah, they did not take the precautions that we are taking now. We have the advantage of time. We've seen how China has experienced this, the outcomes from their own negligence. We've seen how Europe and the Americas are struggling with this. But for us in Africa, we have the advantage of time. Mm-hmm. So we might say, even though we have not experienced it, we've learned from the experiences of other people how to deal with this. But the media must keep sending that message, showing people what is happening, getting all these videos from the wire services and telling people and showing them that this is actually happening in other parts of the world. If we are not careful, it will start happening.
Yes.